When babies are very, very young, they tend to just move their arms and legs around rather at random. They will look around, but they won't really fix on anything. By the time a baby is about 6 weeks of age, they should be able to fix on your eyes and follow you around.
But then, I have also heard that if your baby is having fever, then you can give the baby a cold bath. So I don't know if that would help the child.
You see, there's two problems with that. And the first is that in some ways a fever itself is a normal response to infection. And we can give some medications or we can give some cold sponging to help the baby's fever to come down as a way of making the baby or the child feel better. But if we do things like put the child in a cold bath, then their temperature is going to go down very quickly and they can end up going in the opposite direction. And then the temperature gets too low, and that can be dangerous. So we should avoid doing that.
Okay, thank you. So what about their dietary plan according to, like as they're growing?
Yes.
Month-wise, so what should be their dietary plan?
So there is a lot of discussion around this. How should you wean a baby? When should you wean a baby? And what should you wean a baby
exactly.
up to? What food should you give a baby? And there are a number of different approaches to this. So if we were to follow the strict WHO criteria or guidelines for when a baby should be weaned, then they suggest that a baby should not be weaned onto any solid foods until they are 6 months of age if they are only getting mother's milk. And the reason for that is to avoid any risk of infection. And mother's milk is adequate for nutrition. But what we will often find is that even before 6 months of age, babies will start to show signs that they would like some solid food. And then that brings us on to the idea of something called baby-led weaning. Okay. And for any parent, if you watch your child as they start to grow up, once they get to about 4 months, 5 months, they will start to show signs that they're ready to take some food. You'll be sitting having a meal, and your child will look at you, and maybe they'll put their hand out. As you're eating, they will make some faces as well, like they're chewing or they want to eat something. And if they do that, then it's absolutely fine to start to give them some food at that point. Then it comes on to the question of what food should we give. My personal advice is that you should offer the child the food that you're eating. There is no reason to not give any particular type of food. Okay. The only thing in that is to be sensible and not to give the baby too much salt. Salt is something that in general should be avoided. And the other thing is obviously, and I think this would be logical to most people, is not to give the child spice. Because we may be able to handle the spice, but the baby would not. And that would be quite an uncomfortable thing for them. So other than those two things, we should be able to offer babies whatever we're eating. And whilst having an understanding that the baby is not going to be able to chew a bone or chew something hard, so we might need to make it a little bit soft for them.
Okay, thank you. So what are the key development milestones for children that the parents should know and should be considered? If you can highlight on some of the milestones for an infant.
Okay. So the things that I normally ask parents to look out for and to be mindful of as a child is getting older. And I think for a lot of parents who have had one child, they already know what those things are because they see their child doing those things. But when babies are very, very young, they tend to just move their arms and legs around rather at random. They will look around, but they won't really fix on anything. By the time a baby is about 6 weeks of age, they should be able to fix on your eyes and follow you around a room, or fix on an object and follow it around a room. So that's one thing. When they're 6 weeks old, you should have an idea of whether a child is responsive to noises. And it's a good thing to look out for. And especially if there is a noise in the room, will the baby turn to that noise? And that tells us something about the hearing. As they start to get into that stage when they're 6 weeks old, they will start to make some noises as well themselves. Obviously not words, but starting to babble. And that will develop further as they get older. Okay. And the baby should be able to feed on their own and those things. That's to be expected and normal. Now, as this child starts to get a little bit older, by the time they're about 3 or 4 months old, we should see that the baby is able to turn themselves over and move from back to front and front to back. By the time they're about 6 months old, and for some children it can be a little bit earlier, for some a little bit later, they should be able to sit on their own unsupported, without any sort of support. And you can often see with children that when they're about 4 months, 5 months, they can sit for a little bit, or maybe with a hand placed at their back, but then they will fall. But by the time they're 6 months, they should be able to hold that on their own. And then by the time they're about 8 months of age, they should be really mimicking things that other people are doing a lot more. They should be able to pick up small objects between their finger and thumb from the floor. And that indicates that they have some good motor control. Their fingers and their eyes are good as well. Okay. By the time they're a year old, we should see that babies are starting to use their first word. And it may not be used consistently or may not be used in a way where they necessarily understand what it is, but a word that they use repeatedly. And it may be calling mother or calling father. And by the time they are a year old, they should be pulling themselves up to stand on their own, on furniture, say, and starting to take their first steps. And some children, by the time they're a year old, they're independent in terms of walking. But for some children, it can be a little bit later. So up until a year of age, those are the main milestones that I ask parents to look out for.
Yeah, that's... thank you very much for clarifying these things. And what about some of the behavior issues that you might notice in a child, in an infant, that parents should report or consult doctors?
So I think that's a really important one, because there are some behaviors which are normal and some things that parents will get worried about, which actually are not necessarily a cause for concern. So a lot of babies will get a little bit of colic, pain in their abdomen, and so will cry because of that. It is not uncommon for babies to get a little bit of reflux, milk coming back up, and maybe a little bit of milk coming into their mouth. And that's also okay, especially in the very young babies up until a month of age. That's okay. Crying in general is often a behavioral problem that parents will report and say, my baby cries a lot. And it can be related to one of those two things that I just mentioned, or it can just be related to the fact that they're a baby. And crying is the only way they have of communicating to the world that they have some distress. And that distress may be, I'm hungry, I'm cold, I'm hot, I've got a wet nappy, or just that I'm bored and I want someone to talk to me. So babies will also cry for attention. And that isn't necessarily a bad thing, because each of us wants attention. We want people to talk to. And so why should the baby not? And so often that is thought of as a behavioral issue, but it's not a behavioral issue. It's just the child is communicating with you. And if you learn what it is it wants to say to you, then you will be able to respond appropriately.
Thank you very much for that as well. So what about your last piece of advice for the listeners, especially to the parents concerning upbringing of their children?
So I think there's a couple of things that I would say from that point of view. One thing that I always ask parents of newborn babies to look out for is if their baby gets jaundiced and looks yellow in the first few days of life. This is very common. About half of babies will get jaundiced in some way, and visibly so. And there are unfortunately different practices in different parts of the world. Here in the Gambia, for instance, my Gambian colleagues tell me that some parents will say that this is like yellow fever, and that they won't unfortunately take the baby to see the doctor if this happens, and they should. If their baby looks jaundiced, they should take the baby to see the doctor. And in the Indian subcontinent, sometimes the treatment is just, we put the baby outside in the light and give it some water. This is not adequate. If your baby looks jaundiced, if they look yellow, especially in the hands and feet or the eyes, then you should take your baby to see the doctor to be checked.
Okay. So, to be specific about the Gambia, what are the most common infections you have seen?
So, the most common infections that we see, especially in the newborn period, are pneumonia, diarrhea, skin infections. Those are the most common. And so, as a general piece of advice, if a baby ever has fever, as I said, newborn babies, if they have fever, they should go and see the doctor. But any difficulty with their breathing, if they look yellow, we've already said, if they have any sort of rash or break in the skin, then they should go and see the doctor. And then diarrhea as well. Diarrhea should be taken very seriously in babies.
Okay, thank you very much, Dr. Hamad Khan, for joining us today and sharing this wonderful piece of advice for the benefit of the masses. So it was a pleasure having you, taking out time and joining us for the podcast today. Jazakallah. And dear viewers, that's all for today. Until we come your way, till then, take care. Assalamu alaikum wa rahmatullahi wa barakatuhu.
The purpose of yoga is, like you said already, is to unite the body, the breath, the mind, and the spirit. So the word signifies that.